speaking as a physician, we would all love for things to be better by then. I have no information, none of the data that I've seen, the unbelievable increases in cases that we're seeing in New York City. I see no indication that would support a general resolution or that things will be really looking great 19 days from now. I think the number of deaths will still be increasing. I think we're in an incredibly dire situation, and it is actually getting worse day by day in New York City. So, I wish I had better news for you. I do not.
Jay, so is the president's call too soon?
Well, I'm not a doctor, and I am listening very carefully to Dr. Fauci and Dr. Birx with the Coronavirus Task Force and the CDC. But look, here's the thing for manufacturers. We are on the front lines right now, and many of our facilities can't shut because we are producing the very products that our healthcare officials and our hospitals need to be able to fight against this outbreak. So our folks are on the lines, and we're also repurposing some of our current existing facilities to be able to handle the personal care products, personal protection products that are so necessary for our frontline healthcare workers.
Dr. Powell, it's such a delicate line. We have to protect people's health at all costs, while at some point figure out when a responsible time is to try and restart the economy while taking care of our workers.
Issue, and I can't, of course, speak to the economic scene. That's not my area of expertise. I will tell you that looking at the data from 24 hours ago in New York City, almost about 57% of cases are people less than 50 years old, and about a quarter of the deaths, a little bit more than that actually, are people less than 65. So when people say it'll be really easy, we'll just keep everybody vulnerable inside and everybody else can go out about their business and it won't be any more than a summer cold, I just have to tell you, as a physician and an ethicist, I think that is really wrong. Good ethics requires good facts. Young people are not safe. I'm very appreciative of Mr. Timmons' comments. You're right. We've got to get this personal protective equipment made. That's incredibly important that those factories making critical supplies are open. But that's not the same as saying open every restaurant. Let's really just pretend that the problem will be fine in a few weeks.
Jay, do you want to answer that? And also, I mean, how should non-critical manufacturers be conducting their business now, if at all? You don't think that non-critical manufacturing should be going on today, do you?
So, that is a very, very good question, Scott. And here's the conundrum that we're in. As we are asking more and more manufacturers to repurpose their facilities or to produce something that they haven't necessarily produced before, that means that some of these factories are going to be considered non-critical. That could turn into critical manufacturing. So we have to be very careful to work with manufacturers. We're working very closely with our state manufacturing associations as they deal with their governors and their local leaders on how to identify the critical parts of the supply chain and the manufacturing economy. It's really not that easy to say this is critical, that's not, when you're asking manufacturers all across the country to repurpose their operations.
I think you understand, though, generally what I'm speaking to. If a manufacturer isn't making personal protective equipment, for example, or a ventilator, and it's a product that is not critical to this current situation, should those folks be on the job, on the line?
Right. So, or if they don't have the capability of doing it. So I get exactly what you're talking about, and I think you're making a very good point. The other thing that we have to think about that most people don't really consider in all of this is we have to make sure that food manufacturers and personal care manufacturers can be operational, because we can't let there be a breakdown in the food supply either. So we have a lot of concerns for our food manufacturers as well as our medical professionals being able to obtain those personal protective equipment and supplies because they have to be sanitary as well when they're doing their work.
Sure.
There's a lot of this throughout the supply chain, and I agree with you and the doctor that we certainly don't want to see non-essential businesses opening up too soon. And I think we've seen what's happening around the world when you get a spike and then a drop and then another spike. We have to be smart about this. But I do think that we can be smart in the manufacturing sector, and we have been smart, and we will continue to be.
Dr. Powell, one of the main issues is the 15-day period that we've been in will end in just about a week. We certainly, as you well know from your position in this area, the numbers are going to be worse. The data is likely to be alarming and hard to bear. Yeah,
I agree completely. I wish I didn't, but it is really going up now. I've been a physician for some decades. When I was young, we were in the AIDS epidemic. But the people that I'm talking to and working with, old and young, are physicians who have never seen anything like this before, and we wish we had not seen this. It is really just beyond awful. There are so many people who are sick, and figuring out how to provide good or even adequate care to this massive number of people is really, boy, I'll be amazed if we can pull this off. And so sending people out, and particularly encouraging young people to think they're safe, is just going to increase radically the number of people who get sick. So even a small percentage of those people going to the ICU will further overwhelm us. I don't know how we're going to do it, and boy, I hope we can pull through.
We appreciate your time this evening. Dr. Powell, J. Timmons.